For tuning in. This is class 7. So we are on the last week, one class to go after today. We have, actually, this is wrong. We've already done range of motion shoulder. We are going to learn about bedpan, catheter care, and emptying the drainage bag. So today is all about urinary skills. And most of it is stuff that we've already learned about, so there's not a whole lot new to learn. So I'll be teaching for about 2 hours. We won't take our break while I'm teaching. I'm just going to get through these 3 skills, 1, 2, 3. We'll take our break. The rest of the class will be practice time. So we'll be signing off a little bit early today so that the students in class have a chance to practice. If you're tuning in from home and you're not here in my classroom to practice, please make sure you're practicing somewhere. It's like the driving test. You wouldn't go take your driving test having never driven, because you're probably not going to pass, right? When you're learning to drive, you do things wrong all the time. You step on the gas too hard. You step on the brake too hard. You cut the wheel too hard and run over the curb. You back into a few mailboxes before you kind of work out all of the details, right? Well, the skills test is just like that. We have to understand that because it's a performance-based test, we have to perform the skills. And if we don't have any experience performing the skills, we're probably not going to do all that great. Watching is not enough. I mean, I can watch fighter pilots all day long. That doesn't mean I should jump in the cockpit and take off, right? My chances of success very low. So you have to treat this the same way. If you're not practicing here in this classroom, please order a practice kit so that you have all of the right supplies that you need to be able to practice these skills in your own home, using the same supplies you'll be using in the clinical test setting. That way you're familiar with the actual gate belt, the actual drainage bag, the basins, the toothettes, the denture brush, all of the things that you need are in the practice kit, and it comes in a carrying case. So those of you that are attending from home, that's going to be a priority for you to make sure you're practicing the right way. All right, but you guys get practice time in class today. Okay, so over the weekend, you had 2 chapters, chapters 8 and 9. So, and forgive me because it takes me forever to learn your guys' names, and then you're gone. So are you Tiana? Is that right? Okay, Tiana, what did you get on 8 and 9? Thank you. And are you Michaela? Ashanti, sorry. Sorry. Thank you. Okay, I think Michaela sat over there.
No, I sat over there.
Oh, okay, all right. I try to put names with positions because no worries, no worries. Okay. Does anybody have any questions on what you read, the questions for the review, anything that I can answer for you? Anything I can answer? Okay. All right, those of you tuning in virtually, if you have any questions, please drop them in the chat for me. So only one class left. If you have not registered for the test, what are you waiting for? You're not going to be any more confident than you are right now. Even with practice, you're not going to be any more confident. This is your max level of confidence. So register for the test. Don't put it off. All right. Testing care plans. This is mainly for those of you who are attending virtually. Remember that you can order these. They have the actual checklist you're going to be graded on the back. They have the 3 skills you're going to be asked to do on the front. These are the exact testing care plan sets used by Prometric testing. So if you really want to make sure that you're practicing the right way, that you're getting everything checked off, you probably should order these for you guys here in class. They're right here. You can also get a set for yourself if you're going to be practicing at home. Game show tomorrow. I'm going home today to write the questions. I believe tomorrow I'm going to focus on the role of the nurse aide, which is section 1 from the test plan. So it's going to be 15 test-like questions from that specific section, kind of give you an idea of the topics that are covered in that section, the way the questions are going to be presented, the content, but also the structure. So it's a really fun way to practice for the state exam. It's at 11 a.m. Eastern on our YouTube channel. We don't broadcast that anywhere else. That is specifically on my YouTube channel. So if you go to youtube.com/foryourCNA, tune in at 11. I'll be live and you can compete for real prizes. CPR, you don't need it for class. You don't need it for the test. You will need it to work in healthcare. So if you have not gotten CPR before now, you probably want to kind of put that on your to-do list before you start applying for jobs, because most will require that prior to application. This is the part of the class that you guys should be starting to wonder, where should I start looking for a job? Where is the best place for me to start? Where should I work? And I created an entire quiz. It took me over 2 years to develop this. There's a ton of psychology in it. It's going to ask you 19 personality questions. What kind of person are you? Do you like working alone? Do you like working as part of a group? Are you self-motivated? Do you need a more structured setting and supervision? Do you like a lot to get to know your patients really, really well? Or are you more of a, let me go in, get what I need done, and then leave? You know, how emotionally involved do you want to get? What kind of advancement are you looking for? Is this a step in your career and you're looking to advance? Or is this a way to make a living now? So where's your focus? When you answer all of these questions, it's going to collate all of the answers and show you the best workplace for you based on your personality. Now, this is really important to get right, especially right out of the gate. A lot of people come to class and they think, I want to work in a hospital. That's kind of like everybody's dream job. I want to go work at a hospital. The problem is that your personality may not be suited to that setting. For instance, one of my kids, not this one, hates change. I mean, absolutely will do everything in his power to avoid change. When he was little, if I colored my hair, he would cry. I mean, change is absolutely the antithesis of everything he is. Now, if he were to go to work in a hospital, that would not be a good match, because hospital is all about change. There are admissions and discharges every single shift. Sometimes people get admitted and discharged in the same 24 hours. This is not the kind of place that you go in and do the exact same job, the exact same way every day. There's no routine here. So his personality is not well suited to that setting. Now, on the other hand, I am very adverse to boredom. I am the type of person that has to solve problems. If I have a job where you tell me to put this in here all day long, I am just going to lose my mind, because there's no problem there for me to solve. I'll create one. I will create a problem if there isn't one to solve. That's not a good setting for me. So for me, I thrive more in the high energy departments, in the ER, in ICU, where I'm having to actively solve problems, right? So I would not be good in a routine-oriented environment, but my son would not be good in a high-pressure, fast change environment. We have to know where we are going to thrive. And that's what led me to create this. Now, why is this important for you guys brand new? Because if you pick wrong, if you think I'm a hospital person and you go apply to the hospitals and you get hired and your personality does not match up with the requirements of the workplace, you will not just leave that job, you will probably leave the industry. Which means, because you're going to think that all healthcare jobs are like this because you have no point of reference, no experience. So instead of just finding a different location, a different place, a different modality, you'll just leave healthcare thinking it's all alike. Healthcare's not for me. Well, now you have just spent all of this time and all of this money on a certification that you're not going to use. That's a serious detriment to you. But it also affects your self-confidence. I don't want to see that. We want to build you up, not tear you down. But it also affects the industry as a whole, because we need good healthcare workers, but we need them appropriately placed. And that's why I created this. Okay. So take a few minutes. It's free. Doesn't cost you anything. I'm not going to spam you. In fact, we only email you for after class. Ask them. I mean, these people they don't even get emails from me. I don't send email. I am the world's worst marketer. Seriously, I'm horrible. We're not going to spam you. I'm not going to sell your stuff. Just all I need your email address for is so I can send you. Yeah, that's it. All right, this is our final. I thought 6 was our final review. This is our final review. Okay. 7 is our final review. All right, so skill rules. And we all know these. I'm going to go through them super, super fast because we know this. So we're going to follow the care plan, the whole care plan, nothing but the care plan. While we're doing that, we make observations. We report those to the nurse. This is what drives the bus. Every skill starts with an opening. Every opening starts with a knock. We're going to greet our resident, address them by name, introduce ourselves by name and title, tell them what we're there to do, get permission, close curtain, wash hands, and then you can get your supplies. Do not ever touch that patient until you've washed your hands. Cardinal rule. You may need gloves for some skills. Remember, this is not skill dependent, it's patient dependent. So ask yourself, am I going to touch body fluids, personal skin, or non-intact skin for this skill? If the answer is no, you do not need gloves. If the answer is yes or maybe, you do. If you decide to wear gloves, the first thing those gloves should touch is the patient. Good morning. Once you've touched the patient, those gloves are now soiled. Be careful about what you're touching in the environment for cross-contamination, and then remove your gloves correctly. Pinch up and then go under. If you're going to use supplies, you need a clean place to put them. That's what a barrier is for. We only touch supplies with clean hands. We don't hold them next to our uniform, and we get that barrier first and then go get your supplies. One of the supplies you may need is a privacy blanket. We use this to keep our patient warm and provide privacy, and it's going to be used anytime your patient is uncovered or undressed. We're going to place the blanket on top of the sheet without snapping it or shaking it and pull the sheet down underneath. And then if you have gloves on, those gloves have to be off before you remove the privacy blanket. Linen rules. These are mostly repeats. Don't let the linens touch your uniform. You have to have clean hands to get your linens. Don't snap or shake them. Don't let them touch the floor, right? These are all, we know these. Anything you take and don't use has to be discarded. And there's a principle here that we're actually going to use again today. Clean rolls toward me, dirty rolls away. And this has to do with anything that we're putting underneath the patient. Always make sure your patient is in the middle of the bed. You can't rely on side rails to keep them safe. That's your job, not the bed's job. So we scoot our patient toward us, roll them away from us so they're in the middle of the bed after the turn if we need to turn them. We remain behind, the patient's behind, and the patient must always be in the middle of the bed. So always take a step back and look at the patient. Don't get so wrapped up in your steps that you forget to look at the patient that you're doing those steps on. We also learned washing rules. Now, this made up a big portion of our program. We're going to see this again today as well. Washing rules are very regimented, very repeatable. We do the same thing every time, no matter what we're washing. Don't add soap to your basin. Use a paper towel to get the water. Check it with your wrist. It should feel warm. Not hot, not cold, just warm. Ask your patient to check it as well. But don't add soap to the water because you need that water clean for rinsing. We add soap to our wet washcloth instead. No drippy wet washcloths, by the way. Make sure you wring it out really well. Change that water out if it gets cold or soapy. If you're going to be washing any wet body openings, eyes, nose, mouth, genitals, rectal area, wounds, rashes, sores, or incisions, you need to use the leaves method, which helps isolate pathogens and keeps us from introducing pathogens from one area to another. Marie says, my niece passed, and thank you. Congratulations. Congratulations. Super proud. Thank you so much for checking in and letting us know. Yes, yes. So generational. Thank you. Whatever we wash, we dry. Whatever, or wash, we rinse. Whatever rinse, we dry. Don't get your surface wet. And if you're going to use lotion, warm it up first and then wipe off the excess. Now, anytime that we have something that holds liquid, we have to clean it. So whether it's an emesis basin from mouth care or denture care, or a bath basin from a bathing skill, or today we're going to do bedpan, or graduate container. If it held a liquid, we have to clean it. Now for the test, all they require is that you rinse it, dry it, and store it. That's all they're looking at here. But when we do that, we kind of want a little bit higher level of awareness so that we're not cross-contaminating stuff, right? So we're going to dump our contents wherever it would normally go. We'll rinse the basin, dump the rinse water wherever the contents went. Then we're going to set it down and spray it if necessary. Once it's disinfected, you can pick it up with a paper towel, dry the inside with a paper towel, throw that away, dry the outside with a paper towel, throw that away, and then go to the drawer and open the drawer with a paper towel to store the basin. We also learned shoe rules. If the patient's feet hit the floor, we got to talk about their shoes. Slippers, socks are not enough. They don't protect against sharp injuries. They don't really protect well against slips and falls, and they certainly don't do anything to prevent pathogen transfer. Socks are not enough. Shoes need to be used. If you're going to use a gait belt, that gait belt goes over the clothing around the waist. We check it with 4 fingers to make sure it's tight enough so it doesn't slip up as we're lifting the patient. You're going to maintain your own body mechanics, 1 foot in front of the feet, 1 foot parallel to the body. You're going to put your hands around their waist and grab the gait belt, their hands on your shoulders, and on the count of 3, you're going to stand them up. Ask if they're dizzy. Give them a minute to adjust. After walking or transferring, whatever the case may be, you want to make sure they can feel that chair behind them before you set them down. Very important. And then when you remove the gait belt, don't pull it off against the skin, loop it up and over, or reach both hands around and grab it, but don't pull it against the clothing or the skin. And then the closing. This is how we end every skill, right? We have to end the skill with clean hands. So you want to make sure the patient's in a clean and safe environment, that the bed is in the low position, that they've got their call light. You ask them if they're comfortable and address their preferences. Would you like something before I go? You want to open the privacy curtain and make sure all of that is done before you go clean your hands. So once you've got all of the closing, and I think of it as comfort curtain, call light, clean. Once you got all that done, then go wash your hands, document if necessary, and then wash your hands again, because we do have to end skill with clean hands. Pulse, normal is 60 to 100. Follow the care plan. Care plan is going to tell you to count for 1 minute, count for 1 minute. Dressing a resident, you have to undress and dress appropriately when they have a weak arm. So undress the strong arm first and then dress the weak arm first. Minimize exposure with this one. Use that privacy blanket, close that curtain, get that clothing before you undress them. Minimize exposure with this. Hand and nail care, mani-mani. Soak the hand, wash the hand, rinse the hand, dry the hand. Clean under the nails, wiping it off in between, file in one direction only, and apply lotion last. Wipe off that lotion. Making an occupied bed, you're going to change the bottom sheet a half at a time. So turn them on their side, clean rolls toward me, dirty rolls away. You're going to change that bottom sheet using that method, and then put the top sheet and pillowcase on. Keep them in the bed. Don't let them fall on the floor. Side lying position. This is how we turn somebody who can't do this themselves. So if they really can't move or roll on their own, getting their extremities in the right position helps reduce the effort for us and them. So furthest arm up, closest arm crosses, closest knee bent, furthest knee angle, roll them on their side. Make sure they're in the middle after the roll. And then use some pillows to keep them in that position if the care plan tells you to. Foot care, just like hand and nail care, a little lower. We're going to soak the foot, wash the foot, rinse the foot, dry the foot. We don't do anything with the toenails, but look at the foot, and we apply lotion last. Put their shoe and sock back on. The whole reason you're there is to look. So make sure you're looking. Mouth care, this is brushing teeth. We all know how to do this, but make sure the head of the bed is up. You've protected their clothing, brush their teeth. Let them rinse and spit. The one step that everybody misses here is to make sure their mouth is dry. Respirations, this is the amount of time the patient breathes over 1 full minute. So In and out counts as 1. Normals between 12 and 20. Don't tell your patient you're counting their breathing because it does alter it. That's a documentation skill too. Range of motion. All range of motions are done the same way. You lift from below with a flat palm. You always return back to start. You move slowly and smoothly. Flexion extension is up, down. Abduction, adduction is side to side. Rotation is around and not on the test. Follow your care plan. Denture care. Your patient's going to be sitting in a chair. Dentures are already in a cup. You're not going to take dentures out or put them in. Not your job. You're simply going to clean them. Protect the dentures with a washcloth in the bottom of the sink. Brush the dentures. Put them into a rinsed out denture cup full of cold water. Put them on the counter, on the bedside table on a paper towel, and then do mouth care. This is the hardest skill for students because it is 2 parts. Ambulate. This uses shoe rules, but we're going to walk them as far as the care plan says. For the test, it's going to be at least 10 steps. So that means 5 steps in one direction, 5 steps back. Make sure that there's no obstacles in your way before you lift a patient to a standing position. Partial bed bath. This is our longest skill, but it's a washing skill. There's not really much to do here. Face first, no soap. We're going to wash face to waist, front and back. Give them a little bit of a back rub using all of your washing rules that we've learned. Try to minimize exposure. We don't want our patient to get cold during this. Transfer out of bed and into a wheelchair. Make sure that wheelchair is close to the patient so they don't have to take a step. Get them sitting on the side of the bed. Put their shoes on, their gait belt on, and then bring that wheelchair super, super close. Make sure there's no obstacles. So our leg rests are out of the way. Foot pedals are folded up. Lock it into place. And then you're going to use your body mechanics. Lift, pivot. They can't take steps. Make sure they feel that wheelchair behind them and then help them sit. Turn them around so they're not facing the wall. All wheelchairs that aren't in motion should be locked. Feeding a resident. This is all about safety and socialization. Make sure they're sitting up, have a conversation. You have a seat. It's the only skill that requires you to sit. It's the only skill that requires you to have a conversation. But that's really what is at the heart of eating. We gather in groups to eat and socialize. So make sure you're paying attention to the patient here. Feed them slow. Spoon should only be half full. You're going to document intake at the end of this. And pericare was our final skill. We always wash away from the urethra. Use all of your washing skills here. We're going to use the leaves method. So we're going to wipe down the center, side, skin fold. We're going to rinse and dry, and then we're going to turn them over and clean the back side. Up the middle, cheek, up the middle again, change that pad out from under them. Because if we have a clean patient, we need them on a clean pad. This is done every 2 hours around the clock. Good. Look at how much you've learned. Was anybody lost on any part of that?
No, but the only question, so when we do the denture care and we also do the mouth care, if they just have gums, we use the toothbrush.
For denture care, it really doesn't matter. I mean, you're going to use whatever your care plan tells you to or whatever the patient requires if they have a preference. Whoops. But for the test, we use this. And that's because those gums are going to have denture paste on them, which is sticky and stringy and gummy and has food particles and all that. This allows us, it's a solid surface, so it allows us to swipe and then rotate. So we've got a cleaner surface to work with for gums. Yeah, you can also use it for teeth. Yeah, a lot of hospitals, if you go to the hospital, a lot of times when you ask to brush your teeth, these cost the hospital a lot more than these do. So if you're in the hospital and you don't have your toothbrush with you and you ask for one, you might get one of these because it's less expensive. And you can use it for mouth care. No problem. I've got a mess going on in here. Hold on. I can't. Sorry, guys. I just can't handle a mess. All right. Okay. Okay, so we have 3 skills to learn today. None of them are earth-shattering. None of them are overly hard. None of them are complex, but they may not be you may not be very familiar with them because none of these are things that we do on a regular basis. Okay. So all 3 of these are a little bit challenging for you just because of their unfamiliarity. Make sense? Okay. All right. So the first skill that we're going to learn today is assisting with a bedpan. Now, this is on page 147. And most of us have never, we don't have bedpans at home. It's not something we kind of know what a bedpan is and how it's used, but it's not something that we've probably ever really done before for real. Make sense? Good. All right, if you look down the side, there's no new principles to learn. We know all of the principles involved in this skill. We do have to learn our skill-specific steps. We'll get to that in a minute. But if you look along the bottom here, it tells you that somebody with your level of experience, which is none, should be able to do this skill in 10 minutes or less. But right next to it, it says it's a live patient skill. So that means that one of you may be a patient for this skill. Now, I want to put your mind at ease real quick. You are not going to actually use the bedpan. You are not going to take your clothing off. You're going to remain fully clothed. They're going to put a hospital gown on over your clothing. And you're not really going to pee in the bedpan. So it's a simulation skill. Okay. But we need a live person for this because mannequins don't situate on a bedpan very well. We need that body weight to make this work. Good? Good. All right. So page 148 has our care plan at the top of the page. It also has step-by-step instructions along with our supplies. Just going to pull this out for a second. Put it there. Hey, Jake, make a note for me.
Okay.
Just write cup, if you would. I used to have one here, but I don't know what happened to it. No. Okay. So when it comes to a bedpan, I'll use this for now. So when it comes to a bedpan, the step that is most often missed is the one that has the biggest impact on the patient. So that means that you probably shouldn't miss it. Okay? Because remember, we're graded on the impact of that misstep on the patient. All right, let's look at the care plan here. It says the resident has requested a bedpan. The resident is not wearing undergarments and can wipe self. So I'm going to time out here for just a second, okay? So if you're the patient for this and they put a gown on over your clothing, this care plan says this very specifically for a reason. Because if you're assigned to do this skill on the test, and she's laying in the bed with a gown on over her clothing, you might be tempted to try to take her pants off for her to use the bedpan if you don't understand how the skill is structured, right? So this care plan is written this way so that the evaluators can tell you, point to it and say, no, the patient is not wearing undergarments. You do not have to remove their clothing for this skill, okay? Same thing, if you decide you want to clean them up, clean her up after she uses the bedpan, the evaluators can point to this care plan and say, stop. The care plan says they're able to do that themselves. Please stay out of that area. Make sense? Good. So this care plan is written very specifically for the state exam. In most cases, in a clinical setting, you're going to have to help the patient with this. Because it's really hard to get your clothing off when you're, laying down, right? If they have limited mobility and have to use a bedpan, they have limited mobility. So you may have to help them. You also may have to help them wipe and get cleaned up just because of positioning. There's not a lot of room there. So remember that in a clinical setting, we're going to help them with what they need help with. But for the test, this care plan is very specific. They don't need that help from us. Good? Good. All right. It says the resident is able to move as directed. So we can ask them, can you roll over? Can you sit up? Can you lift? They can move. They just can't get out of bed for whatever reason. We don't have to know why. That's just telling us what they can and cannot do. So all of these principles we know. We're going to follow the care plan. We're going to do our opening. This will require gloves because it's body fluids. We're going to use a barrier. Keep your patient in the middle of the bed. We're going to clean the basin the way we clean all basins, and we're going to do our closing. We know all of this, but we don't know this. So let's focus on these steps. The first thing that you need to understand about bedpan is it is truly a last resort. As a nurse, when this patient gets admitted, I have to do a full head-to-toe assessment, and I'm going to figure out how this patient is going to toilet. In fact, that's the first thing that I'm going to figure out. The very first thing, because I know that every patient is going to have to go to the bathroom this shift. They may not eat. They may not need to get bathed. They may not even get mouth care, but I know for sure that they're going to need to toilet. So toileting is first on the list. I've got to figure that piece out. So the first thing I'm going to ask myself is, can this patient get up and go to the bathroom all by themselves? Do they even need any help? I mean, do they need us for this? And if they can go by themselves and we're not involved at all, that's ideal. That's you, right? You got to go to the bathroom. You get up and you go to the bathroom. Even if I'm teaching, doesn't matter. You go take care of your own needs. I am not involved. Thank you. Thank you. Thank you for that. Okay. That is called bathroom privileges. When the patient takes care of their own bathroom needs without any help. Bathroom privileges. Now, sometimes the patient can get to the bathroom, but they might need some help. They either need some help getting there. They may need some help sitting or standing. They may need some help getting cleaned up. They may need some help getting back to the bed. They need some help somewhere in that process. That would be bathroom with assist. It says, yes, they still go to the bathroom, but they need some help somewhere in there. Okay, good. Now, that's ideal. I want one of those two options. I really want one of those two options, but it doesn't always work out that way. My next option is a bedside commode because it still has kind of the bathroom feel to it. Okay, it's a portable toilet that gets brought right next to the bed, and the patient uses it like a toilet. But instead of flushing, everything is contained in a container that CNAs go clean out in the, go dump in the toilet and clean out as it's used. But it still gives a toilet-esque experience. Okay, good, makes sense. We really want to keep this as toilet-like as we can, because once we start venturing away from the toilet experience, going becomes way harder. So ideally, bathroom. Second choice, bedside commode, either alone or with assist. If those two things don't work, I've only got 3 options left. Now, the first is I'm going to ask myself, is this patient even continent? Like, can they control their own body fluids? If they're incontinent, well, we just do pericare every 2 hours around the clock. This is no longer in play. This doesn't matter. Got it? So now I'm left with two options. The first is a catheter. Now, catheters are not used as often as we used to because we have found that catheters actually increase the risk of mortality, which means that we kill patients. So I'm going to explain that in the next skill. We're going to go into catheters in detail in the next skill. But just be aware that we don't use catheters unless the pee cannot come out on its own, or if the pee that comes out can affect something else, like if they have a big wound that we're trying to heal and we don't want it wet with urine. We don't use catheters for basic toileting. Make sense? So my last resort, the very last thing on my list is a bedpan. I had to go through all of that to get to bedpan. Now, why is bedpan last? You would think it's first. I mean, patients in bed, it's convenient. We just pick up a pan, throw it under their butt. It's, done. Well, the problem with bedpans is that they're super hard for patients to use. You've been trained since you were this tall, don't pee in the bed. Don't pee in the bed. Don't pee in the bed, and certainly don't poop in the bed. And remember that the lessons we learn in childhood stick with us for a very long time. You guys remember learning about that? Okay. So if we put a bedpan underneath our patient, it doesn't mean they're going to be able to use it. It doesn't mean they're going to be able to go because their brain still recognizes they're in bed. Make sense? There's a psychological restriction there. Now, there's also a privacy concern, right? It's hard enough to use a bathroom in public where you've got a stall separating you from somebody next to you. I mean, that's hard. But can you imagine being in a hospital in a bed or a nursing home in a bed and all you have is this curtain separating you from everybody else? Right? There's a lack, even with the curtain, there's a perceived lack of privacy. And it's really hard to make yourself go in an audience. Make sense? So there's a couple things you can do. First, provide as much privacy as you can. If the roommate is able to get up and leave the room, this is a good time to take them for a walk. As much privacy as possible. You can also turn the water on because the sound of water running can help with the urinary letdown reflex. You can put warm water on the inside of the wrists, and that will help as well. You submerge the hands in warm water. That helps with the urinary letdown reflex. But you may have to put a bedpan under somebody 2, 3, 4 times before they're actually able to use it. That's not uncommon. Don't get frustrated with your patients. Understand the psychological restriction here. Good? All right. This care plan specifically says our patient is able to move as directed. So I can ask the patient to lift their hips up. You know, if you bend your knees and put your feet on the bed, you can lift your hips up like a bridge, right? So I'm going to ask my patient to do that. That's the easiest way to put a bedpan underneath a patient's bottom. It's the easiest. But what if my patient can't bridge? Now, this patient can. So for the test, that's what I'm going to do. I'm going to ask them to lift their hips in a bridge. But what if they can't? Well, in a clinical setting, if they can't, you're going to turn the patient on their side, place the bedpan against their bottom, and then roll them back on top of the bedpan. Now, after they've used it, you need to keep this bedpan flat as they roll off of it. So make sure you're holding it steady as they're rolling away from it. Okay, good. For the test, they make this easy. So the first thing we're going to do is put a barrier on the bed. Now remember, clean rolls toward me, dirty rolls away. We've learned this before. So we're going to put a barrier on the bed under the patient's bottom because this bedpan is going to be moving all around and whatever's in there is going to slosh. And we don't want to get the sheets wet or soiled. We're going to position the bedpan under the patient. Now, the way that the bedpan works is this area looks like a toilet seat. So that's where the butt goes. The bottom should sit on the toilet seat, not on the, can you imagine your bottom perched on this this is too wide. It would feel uncomfortable between your legs. This is too narrow and too sharp. It would be uncomfortable under the bottom. It gets put in this way. That, believe it or not, is a graded checkpoint, which way you put the bedpan in. So make sure you put it in with the wider end of the bedpan under the widest end of the patient. Good? Once we've got the bedpan in place, we're going to remove our gloves because we have to put the head of the bed up. Now, this is why. This is a step that is most missed on this skill. but it is also the one that is most important. So if I've got a patient laying in bed, this is my patient, this is my bed, and I put a bedpan underneath their bottom, what does it do to their bottom? What does that do? Lifts it up. How many of you ladies can pee uphill?
I don't think I've tried yet, but I'm willing to.
That's what we're asking them to do. Now, if they're successful, that pee is going to run right up their back and into their hair. And I don't care who you are, that's pretty high on my gross meter. So when you put a bedpan under a patient's bottom, you have to put them in a normal elimination position. Putting the head of the bed up is the most critical step for this skill. The head of the bed. Not the bedpan, not taking it out, not cleaning it. Those are all steps, but that's not the most critical step. The most critical step is the head of the bed because of the impact it has on the patient. Got it? We need them in a normal elimination position. So once we've got them in the position, we're going to give them their call light, their toilet paper, tell them to call us when they're done, but we don't have anywhere to go. We have no other patients for the test. We only have one. So just step on the other side of the curtain and wait. You don't have to wash your hands. You're not leaving the room. You're still in the patient environment. So just step on the other side of the curtain, wait for them to say they're done. They will that quick, right? This is not going to be a long time. It's simulation. They're not actually peeing. Good. Once they say I'm done, then you're going to come back around the curtain. But in a clinical setting, we're not going to stand there. They don't need an audience. We're going to wash our hands, leave the room, and when they indicate with the call light that they're done, we'll go back in. Understand the difference? Okay. So once they let us know they're done, we're going to put that head of the bed back down because we need them to lift off of that bedpan so we can pull it out. If they're sitting on that bedpan, you can't really pull it out. Their body weight is pressing down on it. So we need the head of the bed down so they can lift their hips and we can pull that bedpan out. Now, when we pull the bedpan out, we also want to take the chucks with it, the barrier, what's under them. We want to take it with it. And the reason is you cannot carry an open container of urine through a room. It's bad for infection control. It violates patient privacy. It is just not cool. Don't carry an open container of urine. So when we pull the chucks and the bedpan out together, we can wrap the chucks over the bedpan, and now we have a covered bedpan to take to the bathroom. Okay. So we'll take our covered bedpan to the bathroom, and then we're going to dump our pretend urine. Remember, there's not going to be anything in there for the test. Dump your pretend urine in the toilet, rinse the bedpan, put the rinse water in the toilet, and then we're going to dry it and store it as we dry and store everything else. Now, in a clinical setting, we're going to have a really cool contraption we can use to clean the bedpan, and that is called a bedpan cleaner. It actually looks like a little shower head on a toilet. Usually long-term care settings and acute care settings have this. When you pivot that down over the toilet, it will spray down into the toilet like a shower head. And you can use that to clean the bedpan right over the toilet so you're not using the sink for toileting items. These are awesome.
Now I know what that is. When my grandma was in the nursing home, she had one above her toilet. I never played with it, but I was always curious as to what that darn thing was for.
Yep, it's a bedpan cleaner. Now, here's the problem with bedpan cleaners. We have water under pressure hitting a flat plastic surface. You're going to get splashback. No way around it. You're going to get splashback. Now, we don't want those urine particles on our clothing. So we're going to use a isolation gown, one of those yellow disposable gowns, over our uniform if we're going to use a bedpan cleaner. And you probably want to cover the holes on your face too with a mask and a shield so that we don't get any splashback in any of our holes. Good? Good. All right. Now, let me go back here for just a second. So when a patient is using a bedpan, we have to think about that whole splashback effect, right? Because when you're looking at a bedpan, right? This looks pretty deep, but where their undercarriage is actually right here. So we've only got this much space between the undercarriage and the plastic. When the urine comes out, they're going to get splashback. So their whole peri area is going to get wet using a bedpan. It's unavoidable. Now, hopefully your patient can clean themselves up, but in reality, they may need a little bit of help with that just because that's not much space for you to get in there and clean all of those areas. So keep that in mind. In a clinical setting, you may have to help your patient get cleaned up when using this. Now, there is a way that you can help the patient with this. There are two fundamental problems with bedpans. Number one, you've got that whole splashback issue and sloshing. But number two, this is plastic. And when you put a 98.6 degree human on plastic, the plastic's going to heat up and they're going to stick. So those are our two main problems with bedpans, right? You get splashback and sloshing and you get sticking. So there's two things that you can do if the nurse says it's okay to do them. So one of those things is to put toilet paper in the bottom of the bedpan. So I take toilet paper, make great big loops, loop, 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 lay it in the bottom of the bedpan. It helps absorb the urine, prevents that splashback effect. So it keeps them drier, but it also prevents everything from sloshing around because it absorbs the urine. You can't do that if you're measuring the urine for intake and output. Please remember that. Remember we talked about intake and output last class, right? So if we have to measure the urine, you can't use that. This is all with the nurse's approval. Good? Make sense? The second thing you can do, if the nurse allows you to, is to put baby powder or cornstarch on the seat, this part of the bedpan, just a small dusting. That helps it slide under the patient super easy and helps it slide out as well because they're less likely to stick to the bedpan and you won't have to use any force to get it out. Now, you can't use powders if anybody has a respiratory condition or an open wound or an incision. We don't want powders around any of those. So again, this is something you have to get approval from the nurse. Okay, good? Make sense? Okay. All right. So after we have removed the bedpan, cleaned it, dried it, stored it, and removed our gloves, we're going to give the patient a hand wipe. They've wiped themselves. Our care plan told us they cleaned themselves up. They have to be able to wash their hands. So we're going to give them a hand wipe, but I know where their hands have just been. So once I give them that hand wipe, I don't want to touch that wipe. So I'm going to get a paper towel to collect the wipe and throw it away. And then I'll remove that privacy blanket and pull the sheet up. Kimon, I think it is. Kimon. Good morning, nurse. Why don't you use a bath blanket for the bedpan skill? Great question. I was just about to get there. Great question. So here's the thing about this skill. And I'll preface this by saying I don't like this. Okay. If you look at our older videos, we did use a privacy blanket for this skill. We did. And I still believe that a privacy blanket should be used for this skill. However, the testing checkpoint for this skill specifically states to keep the patient covered with a sheet while using the bedpan. I don't like that. I think that this needs to be revised because if we get splashback and that sheet is over the patient, chances are the sheet is going to get soiled, which means that you're probably going to have to change the sheet. It's way easier to change a privacy blanket than it is a sheet. So in my opinion, we should use a privacy blanket for this skill. But I don't want you to do that. I want you to just keep the patient covered with the sheet because that's what the checkpoint requires for this skill. So you are actually going to see during the skills video, I don't use a privacy blanket for this. Okay, good. Now in a clinical setting, I think privacy blanket is best practice, but I don't write the standards, so. One other thing about this skill, this is something else I don't like. I really don't like. So we are going to use a barrier on the table like we do for every other skill. We get our barrier, put it on the table, we go get our supplies, we put that on the barrier. I have a problem with that because I don't believe that anything that holds human waste should ever be placed on an eating surface. I'm just funny that way. I don't want urine on my dining room table. I think it's kind of gross. Even with a barrier there, it's still pretty gross to me. So I don't like putting a barrier on the table and putting my bedpan on the barrier. Now you'll see that in this video because again, I'm showing you testing standards, what they want for the test. In a clinical setting, I would leave this bedpan in the drawer until I am absolutely ready to put it under the bottom. That's where it belongs. It's got a home. It's happy in its home. Leave it in its home until you're ready to use it. You don't need to take it out and put it on the table. Good? Good. But for the test, we will play the game. Again, this is one skill that I do think needs to be revised in some way. All right. So now we're going to learn how to take all of these principles. Now that we know everything we need to know to do this skill, we're going to apply it to the checklist. So we're going to follow our care plan. We're going to do our opening and get those check marks. We're going to wear gloves, and gloves are required for the skill. It is a body fluid we're working with. We're going to use a barrier on the table so that we're not putting any toileting supplies on our eating surface. We're going to make sure the patient is in the middle of the bed. We're going to clean the basin the way we clean all basins. Rinse it, dry it, store it. Don't dump the pretend urine in the sink, please. You're going to use the test-specific steps we just talked about, and we're going to do our closing. So for this skill, you can see that compared to a lot of the other skills that we've done, the test-specific steps make up a bigger portion of this checklist than in other skills. So make sure you're paying attention to all of those bedpan steps because they are going to be very important on this. Remember, this care plan is only for this patient. All these other people might have different bedpan care plans. Good? All right. Jake's going to show you the video on this.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm well. How are you?
Fantastic. I understand you need a bedpan. Can I help you with that?
Yes, please.
Okay, I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. After I've washed my hands, I'm going to get my supplies. I'll start with a barrier, unfolding it with the absorbent side facing up, and this is going to give me a clean place to put my clean supplies. And we're going to start with the chucks, and then I'll move over here to the patient environment. I need a set of gloves, a second set of gloves, hand wipes, and I'll need the bedpan, which will be in the bottom drawer. I'm going to open the drawer, but I'm not going to touch the bedpan until I put my gloves on. We'll go ahead and put the gloves on. I'll take the barrier and prepare it by holding it up with the absorbent side facing me, and I'm going to roll it toward me. And we're going to set that aside. I'll get the bedpan and the toilet paper out of the drawer, and we'll put those on the bedside table. Now we're ready to start the skill. Okay, Mr. Jones, I'm going to ask you in just a moment to bend your knees and put your feet flat on the bed, and you're going to lift your hips up for me so I can unroll this chucks underneath you. This is going to protect your bedding while you use the bedpan. Okay? So I'm just going to loosen this sheet up a little bit so we've got some working room. I'll take my prepared chucks, and we're going to place it on the bed where we're going to unroll it under the patient. It needs to be under the middle of the patient where the bedpan is going to go to protect the sheets from becoming soiled. Mr. Jones, can you bend your knees? And I want you to lift your hips as high as you can go. Thank you. I'll unroll that chucks all the way to the other end. Okay, you can relax. There you go. Now we're going to put the bedpan under the patient. The wider end of the bedpan goes under the patient's buttocks. So this will be toward the foot of the bed. Mr. Jones, can you lift for me? Thank you. Go ahead and come down. Make sure that that's centered appropriately. All right. And now I can remove this set of gloves. We'll throw these gloves away, and I'm going to put the head of the bed up. Mr. Jones, I'll put the head of the bed up now. That bedpan may shift a little bit. Feel free to move it as you need to, and let me know when you're comfortable. And you can relax your legs. So you comfortable? Okay. Here's your toilet paper. Here's your call light. I'm just going to step on the other side of the curtain and let me know when you're done. Okay, Mr. Jones, are you done?
I am.
Very good. Let me lower the head of the bed. There we go. And I'm going to put my gloves on. All right, Mr. Jones, in just a moment, I'm going to ask you to bend your knees and lift your hips off of the bedpan, but wait until I tell you because I need to hold that bedpan flat.
Okay.
Okay? I'm just going to move this out of the way. I'll take a corner of the chucks. Go ahead and bend your knees. Don't lift yet. I'm going to take a corner of the chucks and hold the front of that bedpan down as he lifts. Go ahead and lift, and I'll pull the whole chucks and bedpan out. Relax. And we're going to take this to the bathroom for disposal. I'll bring the bedpan over to the patient bathroom area. We'll unwrap the chucks from around the bedpan and dispose of the chucks. And then we're going to dispose of the contents of the bedpan into the bedside commode. For testing, this is a simulation skill. There will not be anything in the bedpan, but we're still going to follow through with the simulation. We'll lift up both the seat and the lid. We're going to dispose of the contents of the bedpan into the bedside commode or toilet. And then we're going to rinse the bedpan. We want to put the rinse water into the commode as well. Now I'm going to set the bedpan down into the sink, disinfect it per facility policy, and then use a paper towel to pick it up. I'll take a paper towel to dry the inside. Throw that away. Another paper towel to dry the outside. Throw that away. And then one more for the drawer. Now that I've cleaned the bedpan, I'll get the toilet paper, place it in the bedpan, open the drawer with the paper towel, And then we're going to position this bedpan in the drawer and close the drawer with the paper towels. I'll then throw these paper towels away. We're going to remove the gloves and throw those away. I'll get a paper towel. Mr. Jones, I'm going to give you a hand wipe so you can wash your hands after using the bedpan. Go ahead and take a hand wipe. And then I'll collect that hand wipe after you're done with the paper towel.
Thank you.
This keeps me from touching the hand wipe. We'll throw this away. We're going to throw the barrier away. Clean our work environment. So I'll pull the sheet up, make sure that it looks good. And here's your call light, Mr. Jones. If you need anything at all, just press that red button and we'll be happy to come back and help you. I'm going to remove your bedside table and open your privacy curtain. Is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes.
Would you like a magazine before I go?
No, thank you.
Okay, your bed is in the low position. Your environment is clean. I'm going to go wash my hands. After washing my hands, I'll review the care plan, think about my skill, make any corrections, and then tell the evaluator my skill is done. Yes.
Because like the lower region is weird no matter how you look at it, whether you're a woman or a man. When we're placing a bedpan, are we going basically to like the top crack part, small of the back?
You don't want to get it too far back because then they're going to miss it. You don't want to get it too far forward because then it'll be between their knees. So you need to position it where it's where they can sit on it. So when they're in an upright position, the area they're sitting on will be below the vertical part. Okay. Now remember that that bedpan is on a crease in the bed where we're positioning it because the bed has to bend where the patient bends. Okay. So we've got this bedpan that doesn't bend on a crease that does bend. So when we put the head of the bed up, that bedpan's going to shift. It'll either shift up or it'll shift forward, but it's going to shift a little bit. So I always tell my patients, feel free to adjust it as you need to. Okay. Now for male urination, they use a urinal, which looks like a little milk jug. So their urination needs are a little bit easier to accommodate. We use bedpans for urination in females and defecation in both sexes.
Still seems like it would just be so horrible.
It's uncomfortable. It's, yeah, like I said, remember we use this as a last resort.
Right.
If at all possible, we try to get our patient to the toilet or a bedside commode. Where you're going to find pushback on this, believe it or not, is with staff, because it takes a lot of energy and time to get somebody up out of bed to the bathroom, let them go, clean them up, get them back to bed. There's a lot of time involved there. And a lot of staff members think it's just easier to go in, throw a bedpan under them, leave, go do something else, and come back and clean up after. It's not always best for the patient. And remember that our focus shouldn't be on what's best for us. It's what's best for the patient. And that's what that care plan is all about, because it's the nurse's responsibility to focus on what's best for the patient and lay that out as rules for us to follow. Okay, good, good. Because sometimes, you know, when we're the ones in the trenches, we don't always make the right decisions. Chain of command. All right. So the next two skills that we're going to learn, I'm actually going to talk about these one right after the other, and then I'm going to show you the two videos back to back. So we're not going to do discussion, video like we have been. We're going to do discussion, video. And the reason for that is for the test, these are two separate skills. But in a clinical setting, they're going to go together. When you do catheter care, you're going to empty the bag. It's part of catheter care. But for the purposes of the test, they separated these out into two separate skills. Good? Okay. So the first one we're going to talk about is catheter care. Now, again, you know all of the principles involved here. We know skill rules. We know the opening. We know glove rules. We know barrier. We know privacy blanket. We know linen rules. We know to keep the patient in the middle of the bed. We know washing rules. We know basin cleaning, and we know the closing. Nothing new to learn there. We actually know most of how to clean as well because it's peri-care. We've already learned that. Not much to learn there either. What we have to learn for this skill specifically is about the catheter because there's a high amount of uncomfortableness with dealing with catheters unless you really understand what they are, how they work, kind of all the particulars about them. So we're going to spend some time understanding how catheters work, what they're used for, when they're used, and when they're not used. CNAs do not put catheters in. CNAs do not take catheters out. Now, you can be trained to remove a catheter in some settings, but remember, you would need additional training for that. That's not a base CNA skill. Okay. All right, so your care plan is on page 159, followed by step-by-step instructions. Supplies are at the bottom of the screen. And let's take a look at the care plan for this skill. It says, provide catheter care with soap and water to a female resident with an indwelling urinary catheter. Clean the catheter tubing and perineal area only. It does not tell us to clean the buttocks. Remember with peri-care, we had to clean the peri area and the buttocks because they were laying on this wet pad, and we needed to get that acidic urine off of the skin. You guys remember that? Well, for this skill, it doesn't tell us to clean the buttocks because they're not laying on a urine-soaked pad. The urine is in the catheter. So this skill is going to be cleaning the peri area and the tubing. Peri-care is peri area and buttocks. You guys understand? So catheter care is cleaning the peri area and the tubing, the catheter tubing. Peri-care for an incontinent patient is cleaning the peri area and the buttocks. Okay. Good. Okay, so this is a review of peri-care. We changed the chucks out from under them. We cleaned the peri area, middle, side, skin fold, whatever we wash, we rinse, whatever we rinse, we dry. We turned the patient over. We cleaned the backside, up the middle, cheek, up the middle, and then we changed that pad out again. This was peri-care. Any questions on peri-care? All right. So if you understand how to do this, catheter care becomes very easy. We're not going to change the chucks because there's not going to be one under them. There's no need for a chucks. There's a catheter there to collect the tube or the urine. It's not going everywhere like it did in an incontinent patient. So there's not going to be a chucks under them when you start this skill like there is for peri-care. We're going to put one under them, though, because we don't want to get the sheets wet. So peri-care, we changed the chucks. Catheter care, we place a chucks. Good. Then we're going to clean the peri area, middle, side, skin fold, exactly the same way we did for peri-care. No changes. And then instead of cleaning the backside, we're going to clean the tubing. Now I'm going to show you how to do that, but you just hold the tubing and you wipe along the tubing 4 times. Whatever you wash, you rinse. Whatever you rinse, you dry. And then we're going to take that chucks out at the end because they don't need it. Don't leave a chucks under somebody if they don't need it because chucks holds body heat in, makes patients sweat. We end up with warm, dark, Moist, bad. So no chucks unless they need it to absorb something. Good? Good? All right, so the way that catheter care is different is that we don't clean the backside and we don't leave them on a clean chucks at the end. That's what makes this different than peri-care. So let's talk about catheters. What is a catheter? How does it work? Why do we use it? So catheters are inserted and removed by nurses. This is not a CNA task. This has to require sterile process, which CNAs don't do, sterile technique. But when a nurse puts a catheter in, they insert the catheter and then they blow up this balloon to keep it in place. We're going to go over that in just a minute. That catheter is attached to some sort of a collection device that's just going to hold all that urine. So when a nurse puts a catheter in, it's smooth like this. They just insert it through a hole that's already there. That hole is there. You guys pee through it every day. We're not drilling anything new. We're not making a new entry point. It's already there. So we just put this smooth tube up that entry point into the bladder. Now we know it's in the bladder because we start getting urine coming out of it. Once it's in the bladder, we use a syringe and inject sterile water through the tube. This is a tube in a tube, and it blows up this little balloon at the end. So this is what it looks like. So this is my catheter. It's smooth when I put it in. It's smooth. Once I get it into, I thread it up the urethra into the bladder. Once I know it's in the bladder, I inject sterile water that blows up this little balloon. And then that just acts as a doorstop, keeps it from coming out. I can put a little bit of pressure on this and it's not going to fall out. If I didn't have this balloon inflated, if I put any pressure on it, it would just come right out. So all this is a little doorstop. If I'm going to remove the catheter, I take a syringe. I pull all of that water out of the balloon so it becomes flat again, and it just slides right out. Okay. So I'll pass this around so you guys can take a look at it and play with it. So the only thing holding this catheter in place is that little balloon. Now, the problem is that this will accommodate a certain amount of pressure. You can kind of tug on this tube a little bit and it's not going to come out. That balloon keeps it in place. But if you tug on it too hard, it will come out. And then you've got a balloon this big going through a tube this big. You're going to end up with some tissue tearing. It's going to be painful for the patient. So try not to do that. We're going to talk about that a little bit later. So what is a CNA responsible for? A CNA is responsible for cleaning the catheter and the skin around the catheter usually once a shift. Okay? Usually once a shift. That's what we're responsible for, keeping this system clean. The other thing that you're going to do while you're doing catheter care, while you're keeping the system clean, is you're going to verify the placement of the bag. We want to make sure it's not kinked, right? So that the urine can flow through. We don't want it kinked. We don't want the patient lying on it. We also don't want this bag to touch the floor. Again, nothing on the floor, ever. The only thing that should ever be on the floor is shoes. That's it. So don't let that touch the floor. We also don't want it on a moving part of the bed, because if I put the head of the bed up and this is on a moving part of the bed, it's going to move, and that might not be a good thing for our patient. So not kinked, not touching the floor, not on a moving part of the bed. So we're going to clean the skin around the catheter and the tubing, and we're going to look at the bag. That's our role. Good? That's all we have to do here. So this whole thing together makes up a closed system. Now, what does that mean? So if I have my catheter here, if I put this catheter into a patient, okay, I insert it into the bladder. I inflate my little balloon that holds it in place. I take my syringe out because I don't need that anymore. This is now in place. What that's going to do, the urine is going to go down these holes through this tube and out this hole. That does not help me a bit. Now I've just got urine everywhere. Okay. Does not help me a bit. So what I need is to attach this to some sort of a collection device, something that can hold that urine. The urine's going to come out through the catheter, but I want it to go somewhere, not all over the bed. So catheters are attached to bags. Okay. And that's what you see here. So we're going to talk about the catheter in the bag and all of the pieces of it, but I'm going to pass this around as I'm talking so you guys can see the different pieces as I'm talking about it. Those of you who are attending from home, the practice kit does have the same urinary drainage bag. So you can take a look at it, practice with it, kind of, because I'm passing it around in class today. You guys can't actually feel it. Practice kit will help you with that. Michelle, Miss Patty, I successfully passed both the written and skills exams. Thank you for your teaching. It helps me a lot. Thank you, and I appreciate it. Congratulations, Michelle. Michelle's been attending quite often lately, so I'm so glad that we were able to help you with that. Congratulations and best of luck in your new career. And we love Google reviews, by the way. All right, so let's look at the different components of the catheter system. So way up here, this is what's inserted in the bladder. It's got some little holes. You can see the holes in the catheter as we're passing it around. These holes, the urine is just going to enter the holes and go down through it. It's a straw. That's all it is. It's a straw. This balloon we've already talked about. And then this is the body of the catheter. It's just a long tube. Now at the bottom of the catheter, you've got these two little things here. One is an open port. The other we use to inject the water for the balloon. This open port is what's going to collect to a bag. So the bag just plugs into the port here. You've got tubing. That tubing goes into a bag. Now the bag itself has some markings on it that indicate how many cc's of urine are in there. We do not use this for measuring. This is for the nurse to eyeball, to get an idea, an estimate. This is not used for CNA intake and output measuring. We're actually going to use a triangular graduate container. We're going to empty the bag into a container and use real measurements. CNAs do not use this. This is the emptying port. So this is how we're going to empty the bag. And this is the little house that that port lives in when it's not being used. We're going to talk about that in detail in a few minutes. Right now, this is just an overview. So it's important that you understand this is a two-piece system. You've got a catheter and you've got a bag. Two pieces joined together in the middle. Everybody good with that? Why are they two pieces? Because catheters can stay in place for up to 30 days before we have to change it out. Bags, however, are usually changed once a week. So if we have a bag that's changed once a week and a catheter that's only changed once a month, they have to be two separate pieces. Good? Good. Now, CNAs do not change the bag. That is not your responsibility. Remember I said a few minutes ago, our responsibility is to clean the skin and the tubing and to monitor the placement of the bag. That is our job. This, not our job. We do not separate these two pieces. I'm going to explain why in a minute. But we can be trained to do that.
Wait, question. The tubing, so we'll clean this tube?
No, we're going to clean the catheter. The catheter. I call it catheter tubing. Okay. Yep. That. Yeah. This part. We're going to clean this. Okay. So this skill is the most dangerous skill that CNAs do from an infection control standpoint for the patient. And that's because Catheters kill about 2,500 people a year. This is a really, really, really big danger for patients. This is why we don't use catheters if we don't have a need to use a catheter. And I'm going to explain to you why. Do you guys remember this that we learned in class 2? All right. So urinary review, we have 2 kidneys. Those kidneys filter blood, produce urine, drip, drip, drips down into the bladder. You got a valve at the bottom of the bladder that holds the urine in until you go to the bathroom. This is a review from what we learned last week. Now, when we put a catheter in, we put the catheter in, we inflate that balloon, and now we're holding that valve open. That's really all the catheter does, is it holds that valve open and creates a tunnel for the urine to go through. That's all a catheter is. It's not mystical. It's not magical. It's just a tunnel, tube. But there's a problem with it. And the problem with it is that if bacteria gets into the system, there's nowhere for that bacteria to go except for the bladder. That's it. Now, along the way, it's going to multiply because that's what bacteria do. Urine is an all-you-can-eat buffet for bacteria. All of the proteins and the enzymes that they need to procreate are in the urine. So it is the ideal growing medium for bacteria. So if we let bacteria into this system, it's going to multiply and multiply and multiply and multiply. Make sense? Okay. Now, the closer we are to the bladder when that happens, the more dangerous it is for the patient. So if we let bacteria in way over here, it's got a long way to climb. Right? That's why we change these out once a week. But if we let bacteria in here, it's not so far to climb. Now, the other problem is this is all kind of transparent, open, right? So light hits it. Room air hits it. So we don't have as much warm, dark, moist here as we do here. Do you see that? So if we let bacteria in here, they're getting fresh urine, light is blocked, and it's nice and warm. So that bacteria has an all-you-can-eat buffet and ideal environment to be able to multiply before it gets to the bladder. This is why CNAs do not change the bag, because your opportunity to introduce bacteria here is really high. You would have to be trained to do that. Good? Okay. But what we do as CNAs is we empty this bag. That's the next skill we're going to be looking at here, is emptying this bag. If we aren't really careful and we let bacteria into this bag, when we empty it through this port, that bacteria in here is going to multiply. Not fast, but it will multiply. And then it climbs and it climbs and it climbs and it climbs. And now it gets into the catheter itself. We blocked out light. Everything's warmer. And it's really going to ramp up. So by the time that bacteria gets up to the holes and it can jump out into the bladder, there's trillions of them. Trillions. So this is an overwhelming infection that happens that fast. Now, it's because all of that bacteria was sheltered, allowed to grow, and then invaded all at once. Do you guys see how this might be a problem? So when it comes to catheters, keeping the catheters clean and preventing bacteria from getting into the system is the most important part of catheter care. There are several states that do not allow CNAs to do anything with catheters. Florida's not one of them. In Florida, you can clean and you can empty, but you can't do anything else without training. Good? All right, so there's only 3 places that bacteria can enter the system. This one, where the catheter is put in, that's the nurse's problem, because nurses put catheters in. This one, where the catheter and the bag join, you have to be trained. This one is where bacteria is most likely to enter, and that is in our list of skills. So we've got to be aware of that when we get to that skill. We don't want the bag to touch the floor because we don't want bacteria in the bag. And every time we open that bag, if there's bacteria on the bag, it could get in it. So not on the floor. We also don't want to raise that bag above the level of the patient's hips because that allows urine to run right back into the patient, and it's going to take all of the bacteria in that system with it. So don't raise the bag above the level of the hips. Plus the gross factor here. I don't want recycled urine. This should be a one-way only trip, please. Right? You don't want the tubing to be coiled near the floor. This happens more often than you would think. If the tubing is coiled near the floor and your feet get tangled up in it, you will pull that catheter out without even being aware that you've done it. Now, this isn't life-threatening to the patient. We've got a balloon this big going through a tube this big. You're going to get tissue tearing. There's going to be a little blood, some urine. Your patient will be fine. Don't panic. But we do want to be aware because anytime that there is injury, there's always swelling. This is probably not a place we want swelling. That would be very, very difficult for your patient to work around, right? It's also going to sting really, really bad. So if a catheter gets dislodged, either we pull it out because our feet get tangled, or we pick the patient up and start moving them without taking the catheter with us, and that happens way more often than you would think. Or the patient's confused and they tug it out. If the catheter comes out for any reason, we are going to report it right away. So if you walk into a patient's room and the catheter is laying on the bed instead of in the patient, that needs to be reported. Good? Don't hide it. This happens way more often than you would think. CNAs pull out more catheters than patients do. And it's usually because we're transferring a patient out of bed and into a wheelchair and the catheter bag is on the other side of the bed. Or we're walking a patient. We get them up and we start walking and the bag is on the chair. And the patient will walk right out of that catheter. It'll just pop right out. Okay. The pain usually doesn't hit until like 30 seconds later, and then they'll go, oh. So we need to be aware when we're moving a patient, do they have a catheter? Catheters have to move with the patient. If a catheter comes out for any reason, we're going to notify that nurse right away. We're going to take the catheter in the bag, the whole system, and we're going to put it in an empty trash bag. In the bottom of every trash can in a clinical setting are empty bags, clean bags. Take a clean bag, put the whole system in that clean bag, put it in the bathroom for the nurse to inspect. And here's why. If I have a patient whose catheter came out and I can see the balloon and it's still inflated and completely intact, that's a problem I can deal with. That's something I can work with. If I look at that catheter and the balloon is deflated and there's a hole, that means a part of that catheter is still in that patient. Yeah, and that's not something that I can do anything about. That requires a surgeon. Okay, so as a nurse, I've got to know which problem am I dealing with. Am I dealing with a catheter, all of it came out, I can work with that. Or am I dealing with a catheter and part of it is still in the patient? I need help with that. The only way for me to know is to look at the catheter. Good? Now, I've only got 45 minutes to work with here. That's it, 45 minutes. Because after that, swelling gets so bad in that area that I can't put another catheter in if I need to. It's too swollen. So I've only got 45 minutes. So if a catheter comes out and you go to lunch and then get around to telling me an hour later, oh yeah, I forgot Mr. Jones, his catheter came out a little while ago before I went to lunch, there is nothing I can do. Nothing I can do with that. So this patient is now going to have to pee through burning, torn tissue. And hopefully the swelling isn't so bad he can't pee, right? That creates a real problem for us. One of the problems that we're seeing with CNAs lately is that CNAs are hiding catheters that come out of the patient. They don't want to be reprimanded. They don't want to be lectured. They don't want to be told, you know, they're doing something wrong. So they just hide it for the next shift. What kind of effect do you think that has on the patient? Yeah. All right. So when we're talking about catheters, this is the one we've been focused on so far. This is called an indwelling catheter, also called a Foley cath. Remember, everything has two names. Okay, so this is a Foley catheter indwelling. It has that bubble designed to be left in place for up to 30 days. But we don't always need to leave a catheter in. Sometimes we just need to put one in temporarily to evacuate the bladder, decompress that bladder. So we're only using it for 2 or 3 minutes at a time, and then we're taking it right out. We're not leaving it in place. That is called a straight cath. This one actually has 3 names. Red Robinson, straight cath, or intermittent cath. So this is one that indwells, stays in. This is one that we put in, take out, and then we do it again and then do it again. Right. So you'll see it does not have a bubble. And then we have this type of catheter. Now this is a male catheter or an external catheter or a Texas catheter. It goes on like a condom. It has the same port, right? So this is the same as this and this. This is where the bag attaches to it, but it's external. So you don't have as much invasion of bacteria. This is safer for men. Reduces the amount of potential bacteria invasion. Texas casts or condom casts can be left on for up to 3 days before it's removed and clean. The area is cleaned. Make sure you're cleaning really, really, really well because you've got urine right up next to that skin for long periods. Clean really, really, really well. Follow your care plan as to how to prepare the skin for the next application. Okay, and then a new one goes on. All right, so how do we do peri-care? Well, we're going to do, or how do we do catheter care? We're going to use peri-care. We're just going to hold that catheter out of the way. That's it. So we hold the catheter out of the way. We clean once down the middle, side, skin fold, using that leaves method. Okay, anybody lost? All right, and then once you've used all 5 leaves, remember we're going to use the leaves method, always away from the urethra, then you're going to rinse and dry the peri area. Then we're going to clean the catheter itself. So we want to hold it where it exits the body. You don't want to be pulling on that catheter and tugging on the inside. So holding it on the outside just allows us to control how much it's tugging on the inside. And you're going to use the leaves method. And we're going to wash away from the urethra 4 times. So I'm going to take this first leaf, wrap it around the washcloth, and wipe away from the urethra. Fold that leaf. Wipe away from the urethra. Fold that leaf. Wipe away from the urethra. Fold that leaf. Wipe away from the urethra. Good? Questions? Okay. Whatever we wash, we rinse. Whatever rinse, we dry. And then you're going to remove the chucks out from under them. That's catheter care. So we clean the peri area, just holding the catheter out of the way. And then we clean the tubing, the catheter tubing, holding it where it exits the body, away from the urethra 4 times.
Wait, question. We're cleaning the outside?
The outside of the catheter.
That's
Yeah.
pretty easy.
It's very easy. They actually give you a little less time to do this skill than we had to do peri-care. So peri-care was 17 minutes. This is 15 minutes. And the reason is we don't have to scoot the patient toward us, turn them up on their side, clean the backside, change the chuck. We don't have to do all that. So it shortens the skill a little bit. This is actually a little easier than peri-care. Good? Good? Okay. So now that we know these steps and we know all the principles, well, We're going to go through these steps one at a time. Hold on. So we're going to unroll the chucks under the patient using that clean rolls toward me. We're going to hold the catheter, wipe away from the urethra. We're going to rinse away from the urethra and dry. Whatever we wash, we rinse. Whatever rinse, we dry. And then you're going to clean the catheter, holding it in place so it doesn't tug on the inside. And we're going to wipe away from the urethra at least 3 to 4 inches on the outside. Whatever you wash, you rinse. Whatever you rinse, you dry. And then you'll take that chucks out from under them. Those are the steps involved. You do want to take a look at that bag, make sure it's not touching the floor, it's not above the patient's hips, it's not on a non-moving part of the bed. So let's use all of these now to check off our checklist. A lot of steps on this one. We're going to follow that care plan. We're going to do our opening. We're going to use gloves for this skill. We're going to use a barrier to put our supplies on. We need a privacy blanket, scoot and roll so that we can put that chucks under them. Make sure they're in the middle of the bed. They don't fall off. Washing rules apply. Basin cleaning applies. And then you've got your skill specific steps, but there aren't very many of those. And finally, the closing. Good. So this care plan is for this patient only. Now, before I show you the video for that one, we're going to roll right into drainage bag. This doesn't take me very long to teach you, but remember, this really kind of goes together. So if you go to page 164, you'll see we know all of these principles. We have to learn a little bit about the drainage bag, but that's all. Down here, you've got your test-specific information. Somebody with your level of experience should be able to do this in 9 minutes or less. It's going to be done on a mannequin, and that mannequin will be in bed. This is a documentation skill. We're going to empty the bag and measure what was in the bag. 9 minutes, way more time than you actually need. This is like a 3 to 4 minute skill in reality. Your care plan, step-by-step instructions and supplies are on page 165, but let's look at the care plan for this. It says to empty the resident's urinary drainage bag into a graduate container and measure and record the urinary output in mLs or cc's on the intake and output form. So keep your finger there for a second. Go to page 169 for me. You'll see the intake and output documentation form. Is urine intake or output? It better be. If you document urine output in the intake section, you are stating under oath that this person drank urine. Medical documentation is a legal form. It's just like sitting in a courtroom, putting your hand up and one on the Bible saying, I swear that everything I put on this form is correct. If it gets called into court, that lawyer is going to have a field day with you. So one of the checkpoints for this is to make sure that you're actually documenting output in the output section. So that's what makes this skill a little bit trickier. You've got to make sure you're documenting in the right place. It's the only skill that gives you an option of documenting in the wrong place. Okay, good. Read, take your time. All right, so what do we need to know about drainage bags? Well, there's a lot of different types of drainage bags. This is the one I passed around in class earlier today, okay, the bedside bag. That's that one there. But this is only good when your patient is local. They're in a facility. They're in a home. They're not going anywhere. You don't want to carry a suitcase of urine with you through Winn-Dixie. That's just not cool. People will stare. It's not cool. So when your patient is out and about in the community, we generally use a smaller bag that's much more discreet called a leg bag. This has elastic straps that allow you to strap it to the inside of the thigh or the calf, and it can be covered by clothing. So you've got people walking around our community right now that have a catheter in and you have no idea because they're not carrying a suitcase of urine through the area with them. So it's much more discreet. They're both emptied the same way. We do catheter care the same. The catheter itself is the same. Remember, the bags are what can change. You can't change those bags unless you have additional training. Okay, so leg bag, this is how it would look. You've got these elastic straps that go around either the thigh or the calf, depending on your patient, their preference and their size. Down here is going to be an emptying spout. Up here is where it attaches to the tubing that attaches to the catheter. Good? Okay, bedside bags are usually used if the patient is in a confined setting, a hospital, a nursing home, home care, that type of thing, where they're not out in the public. Bedside bags hold a lot more urine. Leg bags have to be emptied a lot more frequently, usually every 2 to 3 hours, depending on your patient. If they're on diuretics, maybe every 3 to 4 hours if they're not. Okay, so they're going to need to be emptied a lot more frequently. Plus, they're hidden under clothing, so you can't see when they're starting to, fill up. So bedside bags are a little bit easier because they're visible. We can see when they're starting to fill up. Kind of notifies us that there might be something that needs to be reported if it's filling up too fast or not filling at all. So bedside bags are better for observation. Leg bags are better for convenience. Good? Okay, both of these attach to the port on the catheter the same way. So you've got, this would have a tube coming off of it, but you've got this that's going to plug into this, and you've got this that's going to plug into this. They both plug in the same way. All right. When you empty these bags, there's a couple of different ways that they can be emptied. This is the one most commonly used on the state exam. This is the one I have here. It's called a T-valve. I'm going to pass this around again in just a minute. But some bedside bags have a clamp valve. It actually has a little metal clamp that clamps down. And then leg bags operate with a twist valve. So 3 different types of emptying valves. When you go to the test, they are going to show you how to operate the valve in their setting. If you, excuse me, if you get this skill. So if you get emptying the drainage bag, they're going to show you, okay, we use a T valve here. This is how you open and close it. Okay. But I'm going to show you on this one so you're aware. All right. So remember that, and I have to stress this. I cannot stress this enough. CNAs do not separate the bag from the catheter without additional training. This is the #1 error that is made on the state exam. Students will often disconnect the bag from the catheter and take the whole bag over to the bathroom. That is not what we're doing here. We do not separate these two pieces. We empty the bag through this port. The bag stays with the patient. We empty the bag through this port. Good. I cannot stress that enough. That is the #1 error made on this skill. So this is a T-valve. This is what it looks like. It's got a little house that it lives in. So you pull this down to remove it from its house. And when it's hanging down, you've got this crossbar. This is how you open and close a T-valve. Jake, I'm going to need you to zoom. Okay, so you're going to zoom right here on the T-valve.
Sorry, I wish I could zoom
You're
and
good.
move at the same time.
You're good.
And there we go.
Okay, so this has a little house that it lives in. When I remove this from its house, I just pull it down, but I don't want the end of this to touch anything because I don't want to introduce bacteria. So I cannot touch it with my finger. It can't touch the cup. It can't touch the chucks. It can't touch the bed. It can't touch anything. This end has to remain pristine. So in order to open this valve, because right now, if you look through it, you can see, let's go this way. See how it's closed? Okay. So to open it, I would push this valve to the side, and now it's open and urine can come out. You guys see that? Okay. So it's closed. I remove it from its pouch. I open the valve, but notice I did not touch this end at all. I empty into the cup, not touching anything. Once it's empty, then I have to close that valve again, because you have to make sure it's closed before you put it back into its house. Otherwise, bacteria could climb into the bag. Good? Okay. So remove, don't let that end touch anything. Open, not touching the end. Empty, not touching the end. Close, not touching the end. And back into its house. Good?
We're doing all of that, because we're not detachment from.
Right, right,
So we do it on the bedside.
right. We're actually going to be doing it on the floor right beside the bed. Okay,
In the
so
event that you'd accidentally touch the end, how would you keep it from?
you would notify the nurse. For the test, you're going to notify the nurse. Yep, I accidentally touched the end of this, I would notify the nurse, because the nurse is going to have to change the bag.
So there's no way to like disinfect the end of it?
We used to wipe them off with alcohol pads, and that was kind of part of this routine. If you go back and watch previous videos, you'll see that the end of the emptying port was wiped off with alcohol every time we emptied it. But what we found was that alcohol dried out that material. And when the material dried out, it formed micro cracks, which allowed bacteria to harbor in there. So it actually caused more harm than good. Yeah, it's one of those things that where you think you're doing the right thing, you think you're doing a good job, but it's not until we investigate it a little bit more that we find out whether we truly are or not. That's why science is always evolving. Okay. Now, of course, we're going to use gloves when we're doing this. I just did that without gloves on, but we are going to use gloves for this because you can't touch anything that has body fluids without gloves. So we're doing that to answer your question. We're doing this at the bedside. We put a barrier on the floor. We put our graduated container on the barrier, and then we remove our port from its little house, open it, position it over the cup. Don't let it touch anything. Empty it, close it, put it back into its little house. Okay, this is all done on the floor. Good? Good? All right. So please, I cannot stress this enough. Do not let that port touch anything. Not the bag, not the bed, not the cup, not the chucks, and not your gloves either. Nothing. So now we're going to talk a little bit about the container that we're emptying that urine into. This is a triangular graduate container. It's a triangle. It has graduated markings and it holds stuff. This is generally used for urine and nothing else. Sometimes you'll see wound drainage measured in it, but it's a separate cup, never used for anything else. Basically, this is a one body fluid only cup. Please, please do not use these to deliver water to patients. Right. They have pitchers and cups, and I have seen that in a clinical setting. CNAs can't find the water pitcher, so they go grab one of these and get water and take it over. This is for waste products only. Please be mindful of that. Now, once we get this filled with urine, right, we've used our barrier, put it on the floor, we've emptied our bag into this, we closed our valve, restored it. We're going to take this over to the bathroom area. We cannot carry an open container of urine through a room. So we have to wrap the chucks around this as we transport it. Remember the chucks, it's on the floor. Take it to the bathroom. We're going to unwrap it. We're going to set it down and we're going to measure it. Now, it has to be measured in a very specific way, on a barrier, on a flat surface, and at eye level. I cannot hold this up to measure it. It's got to be on a barrier, on a flat surface, and I have to get down at eye level to read it. So the flat surface we're going to use is the lid of the toilet, because toileting should be done in a toilet area. Good? Please don't use this table, please. Eating surface, waste product. All right. So we're going to measure in cc's, and remember cc's and ml's, same thing. Okay, we're going to measure in cc's because our care plan specifically told us to measure in cc's. So when you're looking at this, you'll see there's one side for ounces, there's another side for cc's, and you'll see that this is right at the 16 mark. Should I write 16? Okay, I want to measure at the cc or ml, and we're going to round to the nearest line. If it's closer to 500, we would call it 500. If it were closer to 400, we would call it 400. These little lines in between are 25. So this is 400, 425, 450, 475, 500. Round it to the nearest line. Doesn't matter whether it's up or down. Round to the nearest line. Yeah, I'm going to pass this around. So this right here is the line for 450. This is the line for 400. This is the line for 500. This little line in between 400 and 500 is 425. This little line in between 450 and 500 is 475. Okay. Round to your nearest line. This is going to be a documentation skill. Those of you who are playing along at home, we also have a graduate container in that practice kit. So you can actually use the same supplies you'll be using in the test and be able to hold it and work with it and learn it. So this is a documentation skill. We're going to have to document the amount of output that we measured. And you want to use military time here. If you don't know military time, I have a lesson on it in the book. You can, in the workbook. If you use regular time, you must write AM or PM. Don't just write 9:15 because healthcare happens 24 hours a day. Is that 9:15 AM or PM? I don't know. So either use military time or make sure you're writing AM or PM. Type of output is going to be urine. The amount is how much we measured. Your initials, please do not document in the intake section. We've already learned that we have to wash our hands before we document and then wash our hands again after. Okay? So let's look at each one of these steps individually now that we kind of have an overview. We know all these principles. So we're going to put a barrier on the floor and the container on the barrier. We're going to tilt the bag to make it a little bit easier, but we're not going to separate the bag from the catheter, and we're not going to hold the bag above the hips. You can tilt it to make it a little bit easier, though. We're going to remove the port from its little house. We're going to open it without touching the end. We're going to empty, and then we're going to close it and put it back into its little house. That's actually a graded checkpoint. Closing it and putting it back into its house. Now, look at all of this stuff that's on this one checkpoint. There's a whole lot of words here, isn't there? Empty contents of drainage bag without contaminated draining tube, touching the container, and close and protect drain, clamp it and tuck it into pocket after emptying the bag. All of that is one checkpoint. So if you emptied it, but you touched the container, you don't get that check mark. You have to get everything on there in order to get the check mark.
Question, what if we accidentally touch the...
You would just let the nurse know.
Right, and then we say, oh, our correction, I would let the nurse know.
I would let the nurse know.
What do we say with the check
You
mark?
would still get a check mark.
Okay. It's all about correction.
It's all about recognition, knowing the right steps. So once we've got it emptied, we'll wrap that chucks around the container, take it over to our bathroom area, put it on the lid of the toilet, unwrap it, and get down at eye level and measure. It's got to be on a flat surface, on a barrier. We're measuring at eye level. After measuring, we're going to dump the urine in the toilet because that's where urine goes. We'll rinse the cup, dry the cup, store the cup like we always do. We're going to look at the bag, make sure that it's on a non-moving part of the bed, not touching the floor, not above the hips. Once we're happy with our performance and the bag position, then we can do our closing. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine? Your bed's in low position, environment's clean, open curtain. Here's your call light. I'm going to go wash my hands, document, and then wash my hands again. Good? So let's take all of these and apply them to this checklist. So we're going to follow that care plan. We're going to do our opening. We're definitely going to wear gloves. We're going to use a barrier on the floor. We're going to clean our basin like we clean everything else. We're going to use our skills-specific steps, and we're going to do our closing. And please remember that this care plan is only for this patient, not for anybody else. Every patient will have a different care plan. So we're going to show you these two videos back to back. So Jake's going to show you catheter care first, and then immediately go into drainage bag. Once these two videos are done, he'll be passing out the review sheets as well. Once these two videos are done, we'll go ahead and sign off of people that are attending virtually, and you guys will have the ability to practice after that. Okay? Catheter care, please. Good afternoon, Mrs. Jones. My name is Patty. I'm your CNA today. How are you? Wonderful. I'd like to perform catheter care. Is that okay? Okay, I'm going to close your curtain for privacy, wash my hands, get my supplies, and I'll be right back. Now that I have clean hands, I can get my clean supplies. We're going to place a barrier on the table with the absorbent side facing up. This gives us a clean area for our clean supplies. And for this skill, we're going to need one underpad. We're going to need a towel, 4 washcloths, 1, 2, 3, 4. We're going to need a privacy blanket. We'll bring this over to the patient area. And I'm going to need a basin and soap. And a set of gloves. All right, Ms. Jones, I'm just going to fill your basin. I'll be right back. To fill the basin, I'm going to use a paper towel to turn the faucet on because my hands are clean. I'll use my wrist to feel the water temperature. It should feel warm, not hot, not cold, just warm. And we'll fill the basin about 1/4 of the way full. Mrs. Jones, would you like to check the water temperature? It's good? Wonderful. Okay. I'm going to place this privacy blanket over you, and this is going to help keep you warm and provide privacy as we do this skill. So I'll lay the privacy blanket over the sheet without snapping it or shaking it, and then pull the sheet down to about your waist. I'll put the washcloths in the basin. That way they get warm. And I'm going to prepare the underpad to go under the patient. I'll open it up. I'm going to hold it up lengthwise with the absorbent side facing me, and I'll roll it all the way to the end. Now I can put my gloves on. Okay, Miss Jones, we're going to place an underpad under you to keep your sheets dry while we do this skill. So I'm going to place an underpad on the bed. And in just a moment, I'm going to ask you to scoot toward me. I'm going to roll you on your side, and then we'll spread that underpad out. So on the count of 3, go ahead and scoot toward me. 1, 2, 3. Thank you. And now I'm going to roll you on your side. 1, 2, 3. And as I roll the patient, I want to be careful not to put any stress on this catheter or the tubing. You don't want it pulling tight. So I'm going to unroll the chucks underneath the patient and tuck it under her hip. Miss Jones, come on back and scoot to the middle of the bed, please. Okay, Miss Jones, we're going to repeat the process. Go ahead and scoot toward me. And we're going to roll you onto your left side. 1, 2, 3. And I'll smooth that chucks out underneath the patient. Come on back onto your back. And then scoot to the middle. Now we can begin the cleaning. Miss Jones, I'm going to expose you. I'll make this as brief as possible. But please let me know if you're uncomfortable in any way. I'm going to roll the privacy blanket, making sure that I get the gown inside the blanket as I roll it. But I don't want to grab that catheter as I'm rolling the blanket. So you want to be very gentle with this process. This is going to expose the peri area. And then I'll place a towel over the upper thighs and make sure that the catheter tubing is on the towel. This is to help minimize exposure, increase comfort, and gives a place to put the catheter while we're cleaning it. Now I'm ready to start cleaning. I'm going to take my first washcloth, wring it out, and I'm going to soap 5 corners. 1, 2, 3, 4, 5. I'm going to hold the catheter out of the way, retract her labia, and then wipe down the center, top to bottom, and then move away and fold that leaf. The second leaf will wash the outside of the labia, top to bottom. We'll fold that leaf over. This is going in one direction only, top to bottom. This third leaf is going to wash the other side of the labia, top to bottom. We'll fold that over. The fourth leaf will wash the skin fold between the leg and the groin, top to bottom. We'll fold that over. The last leaf will wash the skin fold on this side, top to bottom. Now we'll set that aside on the barrier. And whatever we wash, we rinse. So we're going to wring that washcloth out really well. Hold it using the leaves method. I'll hold the catheter out of the way and open the labia and rinse down the center one direction, top to bottom. We'll fold that over. We'll rinse the outside of the labia, top to bottom, fold that over. The other outside of the labia, top to bottom, fold that over. This is going to rinse the skin fold. Fold that over, rinse the skin fold. We'll set that aside. Now we're going to clean the tubing. So I'll get washcloth number 3, wring it out really well. Hold it using the leaves method. And I'm going to soak 4 leaves. 1, 2, 3, 4. I'm going to hold the catheter where it exits the body so it doesn't pull on the inside. Wrap the washcloth around the catheter and wipe away from the body. We're going to fold that over and repeat 3 times. Hold the catheter, wipe the washcloth around, and move away from the body. 2, 3, changing the leaf for each stroke, and 4. We'll set this aside. Whatever we wash, we rinse. I'm going to wring the rinsing washcloth out thoroughly, hold it in the diamond shape in my hands, hold the catheter where it exits the body, wipe the washcloth around, and rinse going down the catheter. We'll fold that leaf, rinse 2, fold that leaf, rinse 3, fold that leaf, and rinse 4. We'll set that aside. Whatever we rinse, we dry. So we'll dry the peri area top to bottom and the catheter tubing. We can remove the towel, set it on the table, and we're going to unroll the privacy blanket, trying to be careful not to touch that gown with your soiled gloves, and we'll cover the patient up. Mrs. Jones, can I get you to scoot toward me, and I'm going to remove the pad that's under you. Go ahead and scoot toward me, and on the count of 3, you're going to roll up. 1, 2, 3. I will roll the soiled chucks toward the patient and tuck it underneath her hip. Come on back, Miss Jones. When I'm moving Mrs. Jones, because my gloves are soiled, I'm only touching the outside of the privacy blanket. Mrs. Jones, scoot to the middle of the bed, please. And now we can remove your chucks. If you can scoot toward me, again, my soiled gloves are only going to touch the outside of the blanket. And then you're going to roll up on your side, 1, 2, 3. And I'll remove that chucks from under the patient. Come on back onto your back. And then if you can scoot to the middle. Thank you. I'm going to go dispose of this. Okay, Mrs. Jones, you're covered. You're safely in the middle of the bed. I'm going to go dispose of your linens and clean your basin. I'll be right back. These items will go in dirty linen. We're going to clean this basin the way we clean all basins. I'll bring the basin to the sink and we'll dispose of the water in the sink. Rinse the basin and then dispose of the rinse water into the sink as well. I'm going to set that down, disinfect it per facility policy, and then pick it up with a paper towel. I'm going to get a clean paper towel to dry the inside. I'm going to get a clean paper towel to dry the outside. And then one more for the drawer. On the way, we'll pick up the soap, place it in the basin, use the paper towel to open the middle drawer, pick up the lotion and put it in the basin, and then store the basin in the drawer. We'll close it with a paper towel and then throw those paper towels away. Now we can dispose of the barrier. This will go in the garbage. And I can remove my gloves. Okay, Miss Jones, I'm going to remove your privacy blanket now. I want to check your tubing real quick just to make sure that it's not kinked and you're not lying on it. So it looks good. It's not near the floor. So I'll pull the sheet up over the privacy blanket. This ensures that you're always covered. And I'll remove the blanket as I do so. Want to make sure that the blanket is rolled into a ball so trailing edges don't contaminate other surfaces. We'll make sure that the sheet looks good. All right, Miss Jones, just let me go dispose of this in dirty linen. I'll be right back. We'll adjust the sheet on this side. There you go. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine? Your bed is in the low position. Your environment is clean. Here's your call light. If you need anything at all, go ahead and press the red button. We'll be happy to come help. I'm going to open your curtain and return your overbed table to storage. Now I'll go wash my hands. After washing my hands, I'll review the care plan, make any corrections, and tell the evaluator my skill is done. Good evening, Mrs. Jones. How are you today? Fantastic. I need to empty your urinary drainage bag. Is that okay? I'm going to close your curtain for privacy, wash my hands, get my supplies, and I'll be right back. After washing my hands, I'll get my supplies. We're going to start with the chucks. This is going to go on the floor under the bag. We're going to place the barrier on the floor directly under the urinary drainage bag. So we'll unfold it and we'll place it under the bag with the absorbent side facing up. I'm going to go get a set of gloves. And we're going to get the graduate container out of the drawer. You need to make sure that you put your gloves on before you get the graduate container. We're going to place the container on the barrier directly underneath the bag. We use the emptying port to empty the bag. This is a T-valve. We slide it to the side to open the valve, and then we're going to empty the urine into the graduate container without letting that port touch anything. Once the bag is empty, we'll close the port and place it back in its little house. All right, Ms. Jones, I just want to check to make sure the tubing is coiled on the bed and you're not lying on it, and that it's not coiled near the floor either, where it could become a tripping hazard. Now, I can wrap the chucks around my graduate container for safe and secure transport to the bathroom. We're going to set it down on the lid of the bedside commode and unwrap it, turning the cup around so that we can read the amount of urine that's in the cup. We need to be at eye level. It needs to be on a flat surface and on a barrier. I'm going to throw the chucks away. Open the lid and the seat and dispose of the urine into the bedside commode. I'll rinse the cup and dispose of the rinse water into the bedside commode as well. We'll close that, set the graduate container down in the sink, and disinfect it per facility policy. I'll pick it up with a paper towel, Dry the inside with a paper towel. Throw that away. Dry the outside with a paper towel. Throw that away. And one more for the drawer. Okay, Miss Jones, I'm just going to return this to storage using a paper towel to open the drawer. And closing the drawer. We'll throw those paper towels away. And then I can remove my gloves. You take a peek at your tubing just one last time. Everything looks good. Are you comfortable, Mrs. Jones? Is there anything else I can get for you while I'm here? No? Would you like a magazine before I go? Your bed is in a low position. Your environment is clean. I'm going to open the curtain. Here's your call light. If you need anything at all, just press that red button. We'll be happy to come back and assist you. Thank you very much. I'm going to go wash my hands. After washing my hands, we'll document the amount of output on the documentation sheet provided by the evaluator. We're going to document the time of output, the type of output, which is urine, the amount of output in cc's, and my initials. And we want to make sure that we're documenting in the output section. After documenting, I'll wash my hands one final time. After washing my hands a final time, I'll review the care plan, make any corrections, and then tell the evaluator my skill is done. All right, any questions on those two? Those are the last two skills. You are now done. Good job. Very good job. Remember, the practice kit has everything you need to be able to practice. I'm going to open up for practice for you guys. I'm just reminding them at home. Homework tonight, chapter 10. This is the last homework chapter that you have. It's a pretty easy chapter. You'll get your wrap-up email. But on Wednesday, you need to return that yellow book. So please make sure you bring it back to class with you. We've got a lot of really cool stuff to cover on graduation, things like finding a job, because it is different in healthcare than other industries, how to ace the interview, including that question, tell me a little bit about yourself, and what your next steps are, how to renew, what the renewal requirements are, and how to satisfy them. CPR, BLS, we talked about that earlier today, and Jake just passed out your review sheet. Those of you who are attending virtually, you can actually access these review sheets on flcnatraining.com. Just go to each class. Right next to the class replay is going to be a link for the review sheet, and you can download those and print them out so that you can keep up with what they're getting in class. So thank you guys so much for joining us. We will see you on Wednesday for our final class. Remember, tomorrow is the game show. Tune in at 11 a.m. on our YouTube channel. So youtube.com/foryourCNA, because we only have that on the YouTube channel. And that's a really good way of kind of figuring out what types of questions you're going to have on the state exam. After Wednesday, when we graduate everybody out, our next class will start on March 23rd. I have 2 weeks off in between these two class sessions because I'm getting ready for a conference that I'm going to be attending shortly. So mark your calendars. March 23rd will start our next class session. Until next time, happy caregiving. Bye.